We have a very exciting event ahead of us. Today, we will be speaking with Ruchika Singhal. She's the Vice President of Global Health at Medtronic, and she has created the Medtronic Labs, which is an very, very exciting and interesting incubator that has been creating social businesses in Asia and in Africa. So super, super excited, Ruchika, to have you as part of our discussion here and being our main speaker. And Ruchika is also one of the chosen unusual pioneers, a program that we have started together with the Schwab Foundation and the World Economic Forum. So if we look at what are we going to be doing today, well, there'll be a quick welcome from my end, giving you a little bit of context of where we're coming from at Social Business and the Unusual Pioneers. We will then delve into a fireside chat with Ruchika, who will tell us all of her, how did everything happen? How did she get here? Why is she doing what she's doing? And also, of course, giving advice to other social entrepreneurs. And as in every single Unusual Pioneers event that we've had, we will also have a little bit of a networking session, because there's no unusual event without networking. We want to make sure that you guys interested in unusual things can network with each other and get to know each other, to make sure that we can mainstream this new type of unusual business into the usual business. And then we'll end with Q&A. So this is the agenda for today. And I see already we're getting people from Bangladesh, the UK, and all kinds of other places, Turkey, Munich, Germany, Paris, South Africa, Germany. So I would definitely say this is quite an international group that we have here. So just moving on, to give you a little bit more context, I briefly mentioned it. We at Social Business, together with the Schwab Foundation for Social Entrepreneurship, which is the sister organization of the World Economic Forum, have initiated the Unusual Pioneers. The Unusual Pioneers is a platform for corporate social intrapreneurs and their executives to help, on the one hand, grow the corporate social business, but also, on the other hand, to help use that corporate social business to transform the corporation as a whole and to make them a force for good, as we call it. We basically have two groups we're working with. We have the Unusual Pioneers, so the corporate social entrepreneurs themselves, which are 15 from amazing companies, including Medtronic, MasterCard, Suez, Fifco, Habib Bank, Unilever, AXA, etc., you name it. And there's also a second group, which are the executives that are linked to those corporations. So the CEOs and board members of those companies that will also be exchanging about how important corporate social entrepreneurship is. The program will now get started in August, and we're really, really excited to have this whole fantastic and really inspiring group of true change makers, or as we call them, Unusual Pioneers, together. So obviously we already, we can move to the next slide. Ruchika is the one that we will be speaking to today. And perhaps moving to the next slide, my co-founder, Mohammed Yunus, he always says to build a new world, you really need new roads. And the Unusual Pioneers are those examples of those new roads. And in some ways, the examples of that new type of exciting, inclusive capitalism, social capitalism that I think many of us wish coming out of 1.5 years of the COVID crisis. These Unusual Pioneers, they're already living that dream. They're already creating concrete examples, and supporting them in growing their initiative is part of our theory of change, the way that we actually think we can make a dent in changing the way that our capitalist system works. So with that, kind of basic introduction, I'd love to move into directly introducing my amazing, interlocutor, if that's the right word, Ruchika, today. So Ruchika is and let me just make sure I have the right title in place here. Ruchika is the leader of the Medtronic Labs. Before that, she was at CR Bard as a vice president internationally. She had previously already worked at Medtronic for 14 years in a number of different roles, from strategy, international market development, marketing, and new product development. So she's not like a social dreamer just coming from the social world, but actually someone that has a very, very solid business background. And obviously throughout her career, she's been able to develop businesses in emerging markets that have been scalable and really based on technology, which is, I think, a key point of the work that Medtronic has been doing. So in her private time, next to the work she's already doing with social businesses, she also actively mentors social businesses and works in the field of women empowerment. So she basically, does it all in her private and her business life. She brings it all together and clearly has one passion. And of course, in terms of background, Ruchika is an incredibly intelligent woman with a biomedical engineering background at Johns Hopkins and an MBA from Chicago Booth School. So we have a real superstar here speaking to us today. And I can only say big, big welcome to you, Ruchika.
Thank you, Saskia. It's great to be here. Thanks.
We're super honored to have you as one of our unusual pioneers, and really, really, really glad to have you. So, Ruchika, since you're sort of the star of the whole call here today, I'd love to really jump right in and really start with the question of what exactly are the Medtronic labs? Because I think people know the giant company of Medtronic, but what are the Medtronic labs and what do you concretely do? Like really try in like baby words, assuming nobody is a healthcare expert, tell us, what are you doing?
Absolutely, Saskia. So for folks who don't know Medtronic, I'll start with that. So Medtronic is the largest medical device company in the world. The way I explain it to my parents is we pretty much make anything that goes inside the human body and anything that is utilized to put stuff inside the human body. That's what Medtronic does.
Interesting.
Yeah, pretty much. Broad. Very mission-driven company, always has been. It's the original company in a garage. So I grew up in Medtronic. I was right out of grad school, first job, always very inspired by the mission. And really somewhere along these past 20 years, found myself with the mission, trying to figure out, with inspiration and direction, I must add, from our leadership, to figure out how do we solve healthcare for people who can't afford it. We can't just exclude that. So if we are going to be the biggest healthcare company in the world, then how do we figure out the healthcare challenges for the global middle class, so to speak? So that's really the origin of Medtronic Labs, way before Labs was born, is how do we develop new business models, new technology solutions that really meet the needs of the bulk of humanity. And what we ended up focusing on, there's a couple of things that we have now sort of dialed in on and that we're now growing. But we started out with, those two projects I'll talk about. So one is called Shuti, which really, it's amazing to admit, but it's been 9 years since we started thinking about Shuti. And I have to say, Professor Yunus was one of the first people I had pitched this to before we had even done the first camp. This was a long time ago. And really the idea behind this was inspired by Arvind around addressing cataract and blindness. So what we do with Shuti is address ear diseases, chronic ear infections and hearing loss. You would be amazed, it's actually a pretty big problem. So in parts of India and Southeast Asia, up to 10% of the population has significant hearing issues. And a lot of that stems from just, poor sanitation, poor hygiene, and just awareness. And it's a simple enough problem that you can detect and you can refer, and it's very easily solved. It's a simple surgery, oftentimes it's medication, and hearing aids are cheap and readily available. The constraint has always been that nobody knows that it's a problem. The phrase I always heard in India was, when I first started researching this, was your nose runs, your ear runs, it's all the same thing, part of life. And it's like, no, ear running is actually a very big problem. You can lose hearing and the impact that has on life. So what we do, we develop the whole model around how do you solve the ear disease problem, coming to that, which is, create a technology, a mobile phone-based technology that a health worker with very limited, high school education, can screen people in the community, tie it to a digital application so that a physician sitting remotely can quickly say, yep, this is good, but the basic diagnosis the health worker can do. And then a telecounselor can follow up, call the patient, make sure they show up, get treatment. If they need a hearing aid, we can do the audiology screening in the community as well. We can do a trial fitting, like here, try it right here. Does it feel good? Yes, then you can get it. And it gets the patient all the way from, not knowing what to do about their condition to actually getting treated. So the way we look at how to address these healthcare problems is really this full end-to-end model where it's technology that enables a community-based solution where it's not just about like, oh, I've got a smart diagnostic device, or I've got a digital application, or I do community education, but we actually link it all together. So that's what we do with Shuti. That's exactly the same thing we do with managing diabetes and hypertension. We do
Before
that.
you move to the second social business, I'd love to just maybe follow up once more with Shuti, because I think it's so fascinating, and particularly for our audience to really understand the concrete examples. So if you can walk me through a little bit, Ruchika, how does the business model actually work? So basically, you're a healthcare worker, you go and you find someone that, you test and see if they have a hearing issue. Like, how does it work with payment? Does that patient pay you? Or like, how does the business model work as well of this whole kind of intervention? Just so people understand that even better.
Yeah, no, totally. So honestly, as a device company, when we first started looking at it, I came from the device side, so I understand devices. And it's been a journey to get out of the device mindset to really understand how do you build business models for this new space. So we in Shruti, we actually still do a lot of device-based models. So the way it works is we have the diagnostic device, so like a point of care diagnostic device that we've developed, and a digital application that goes with it, and all the field operation services. So we effectively sell that or charge for the services along with diagnostics to ENTs and audiologists, where they then hire the health workers to go and do the camps and pay the health workers. So the way it works is truly win-win, right? So, we do very discounted costs. We make money right now, but we bring in revenue, but we don't cover all of our costs right now. But as we start to scale, we hope we'll get there. But effectively, because the diagnostics and the hearing aids as well, we actually have a partnership with the hearing aids companies as well, where we have field programmable hearing aids. So there's a margin on that helps cover some of our costs, but they're much lower priced so that an ENT or an audiologist can actually invest. So it's affordable for them to be able to invest. And because they get the extra patient throughput, they're able to recuperate those costs from the additional volume. And because we get multiple patients, or like bring in bulk patients, so to speak, the doctors and the audiologists are also incentivized to give special discounted pricing to the patients, way below their market prices, so to speak, often 30 to 50% lower. So the patient pays less. The patient actually gets brought into the system. The doctors get patients. So they have to invest, and we at least get some money to be able to cover the cost for some of this stuff. So it truly is like we spend a lot of time building Excel models that keep changing the variables all the time, but really just trying to it never stays there. But really just understanding, how much can a patient afford to pay? So let's build it off of that. What does the break even need to look like for an ENT or an audiologist so that it's worth it for the number of patients they could handle? And then we sort of looked at ourselves as the last piece in this. Okay, what do we need? Well, it's going to take us a while to get there, but this is where it's fine. It's a social business. We need to get this started, and we look at it as an investment. But yeah, that's kind of how we built that.
I think that's super interesting how you're also just describing how you reverse engineer the business model to actually fit the needs of the end patient. So to really start from the problem, what could they potentially afford? What can we then even cost, rather than kind of just thinking, well, cost plus, like this is what like our device costs. Let's just sell it to people. Oh, well, the poor people can't afford it. Well, they won't get it then, which is the sort of normal logic of business. So really interesting to see how you've been thinking about that. and interesting to get a little bit more into depth into that concrete model. So in the end, you remain a device manufacturer, and device, like that's your business model, selling the device, but you've actually, next to the device, you've actually created a whole ecosystem with healthcare workers, with the health camps, with the doctors, to actually make this work. You have to go way beyond your normal business model to actually make this work, if I understand that correctly. So that's the Shruti side. And I know you also have created and incubated at least a second social business. I know that you're working on more as well, but perhaps also want to tell us about that second social business that Medtronic Labs has incubated.
Yeah, so the second one is around hypertension and diabetes management. So the concept being the same, we don't have a diagnostic device in this case, we actually partner with others who have diagnostic devices in this case, but really the idea is the same, where we've got a digital platform that enables health workers to go screen patients in the community, diagnose the ones who have hypertension or diabetes, refer them to a facility, or we manage them in a group setting in the field as well, where essentially the community health workers or health coaches are able to provide like basic lifestyle management, medications management, and just patient education. Because so the difference is, like with Shruti, ear disease can be treated with a one-time intervention for the most part. Once you get diagnosed, you get a hearing aid, you're theoretically good, go home. If you have hypertension and diabetes, you need management and you need your blood pressures checked all the time. There's often lifestyle things like what you eat, whether you exercise or not, take medicines all the time regularly. So there's a lot more handholding and sort of engagement with the patients that's required. So that's what we do. So we have a lot of like community-based patient engagement models that we work with and train health workers on. And in this case, we actually do more of a per patient sort of subscription fee that we charge, where again, heavily discounted, but then the digital technology is part of it, because then you can look at over a period of time which patient is doing okay or hasn't shown up for their blood pressure checks, hasn't been taking medications. So, we have telecounselors that'll call these patients and be like, what's going on with you? Oh, I was busy with somebody's wedding, so I didn't go. It's like, no, you need to take medication. So please, we'll have somebody send medication to you. And definitely with COVID, it's been quite a challenge, because this is the population that is extra vulnerable. Majority of the mortality associated with COVID has been people living with diabetes and hypertension. So the work's become even more relevant in that context, where keeping these conditions under control is incredibly important. So yeah, that's the second part of it. And we're doing different versions of this in Kenya, Ghana, India, and actually with a partner in Philippines as well. So yeah.
Fantastic. And I think perhaps also there would love to understand a little bit how you do that, especially in terms of the business model again, and especially in terms of all the many interventions that are now necessary. How do you actually manage to finance that? Because it's a very different thing, as you just described yourself, than with one hearing aid that has to be financed once. But also what you just talked about in terms of the COVID impact. I think probably, healthcare has been so much at the forefront of everything that we've been talking about in the last 1.5 years. How have your social business initiatives been affected by it? Have you been able to continue your work, or did that come to a screeching halt? Perhaps talk us through the business model of Empower Health a bit more, and also more the details around the COVID impact on those social businesses.
Yeah, so the simplest way to describe the Empower Health business model is that we charge like a per patient subscription, so to speak, on an annual basis. So we typically work with employers, private hospital systems, and public health systems as well. We're actually partnering with pharma companies as well to drive adherence to medicines, because they have access drugs. We actually work pretty closely with Novartis, and you had Christina on before too. So if fundamentally that's the model, like a per patient subscription model. That being said, the complexity around diabetes and hypertension is tremendous. So there's a lot of partners involved, where we're working with government, like Ministry of Health and county health systems, with access medicine providers, with diagnostics companies, and it's complicated partnerships is kind of how I would say each one is negotiated sort of independently with the end goal in mind is that we have to make sure that patients get better. So we like doggedly follow on like how many patients are getting better and staying better. And that's how we measure success. And it's like, all right. And then different sources of revenue that come in, I would say. But yeah, the COVID, I have to, I know a bunch of the team members are on the call right now. I have to say, I give the team a ton of credit. Outside of like the government mandated shutdowns, despite me paranoid and worried about people going out in the field, these guys have all been out in the field with full PPE and stuff, figuring out how do we take care of patients, like how do we continue our field operations. A lot of people on our team have gotten sick. It's been a trying year, but I just like give a ton of credit to the team for just powering through. Like unless the government says curfew, you're not out, they've all been out.
Yeah. No, and that's fantastic. And I mean, we've seen this throughout the whole crisis. I mean, social businesses sort of with that DNA of actually wanting to solve a social problem have just been in so many cases really at the forefront and the kind of the first line responders, how we called it, throughout the COVID crisis. And it's great to see that also your Medtronic Labs social businesses have been in the same vein. So really fantastic. Just shows like what it means to be a mission-driven organization and what that actually does. Perhaps now switching gears a little bit, moving away from the concrete examples, just also understanding how this whole thing came about. Because I mean, again, Medtronic is a med tech company, and in general, they're in business to make money. So where did that Medtronic Labs idea come from? Did it come top down? Did it come bottom up from both sides? Tell us a little bit about that.
So I think both, I would say, it's very much, there's more than just me, by the way. In the company, there's a lot of us that are very passionate and very mission driven. And that includes leaders at all levels and, definitely starts at the top. I think Omar and now Jeff have, since the beginning, have just been passionate about it. The first time when Omar first came to Medtronic, like first strat plan season, he's like, oh, ideas, business model innovations to address underserved. And I was like, what is underserved? Let's start with that. Because I was doing deep brain stimulation in the brain. And just like, you don't go from that to working in the community. But it's really, it's like leadership. Omar and Jeff and,
So he's the former CEO, Omar's the former CEO, Jeff is the current CEO, just for everyone in the room who doesn't know, just putting it out there. But yes, continue with Omar.
Yeah, so that's where it started from. So when the CEO starts asking for ideas, then you present ideas. Somebody comes up with ideas, and a bunch of us did. And this is where I give credit, right? Like my boss at the time, who was another person, Jacob, he was the one who fought all the internal battles at the time. And with support, like Omar from the beginning was so engaged, and Jeff at the time as well, before he became CEO, was very engaged. And so it's like all of a sudden, when your top people are paying attention, then all the resistance in the middle disappears. Mm-hmm. So for me, it was actually pretty easy because I had all these like senior level leaders saying, this is interesting, so you need to work on this and tell us what's possible. So, and then, it's like, it becomes easy to put a team around it and just start, that being said, we had our set of challenges and ups and downs, and, the work itself is not easy, like figuring out these solutions, like what works, because it's not like these are problems that you can just solve overnight. And that's where I think the open mind around, I kind of joke with Omar and Jeff and other folks is like, we've been at it for close to 10 years. We're finally getting to a point where this works.
I feel your pain. We also have our 10-year anniversary this year, so.
Seriously, like, how hard is this? Like, if I knew it was going to be this hard 10 years ago, I would have never started this. But, we're figuring it out, as we say. And really, that's how it happened. Over a period of time, it's evolved, and in terms of like how to do this in a large corporation. So we actually ended up spinning it out, so to speak, as a separate legal entity, which helps us, so we call it a public, so it's a US system, it's called a Public Benefits Corporation. So it is a separate legal entity where our financial results don't get rolled in with the parent company, but we're still funded via the Medtronic Foundation. So we spend a lot of time with lawyers figuring this out because it gives us the flexibility and the ability to be nimble in terms of innovating outside of the very complex corporate systems, whether those are HR systems or IT systems or legal. It's like we have the support of all of those people, but we don't have to follow the Medtronic systems, which is really helps with innovation. And then, being separated from the quarterly day-to-day like Wall Street pressures helps a lot too. So it gives us sort of the runway to truly innovate and make mistakes and learn so that we can solve the problem. So I think in a way that has been a big learning over the last 10 years. It's like how best to set it up. So yeah, so that's at some
Super
point.
Interesting.
Yeah.
Perhaps actually, if I can just come exactly on that point, sorry, I think because that's a really interesting question that we often hear from corporate social entrepreneurs, like how close or how far away do we want to create this close to the core business? How can we ring fence the social mission? So the so-called corporate immune system, so all the systems within the company that want to kill off anything that doesn't look like profit only. How can you basically ring fence the mission in a positive way while still being able to positively affect the corporation as a whole? Because of course, if you're just a little island on the side, then basically the corporation will not be in any way positively affected. So how do you basically have that, like what's the right balance? So it's interesting to see your model, but tell me more if you have any additional thoughts of like how to find that right balance.
Yeah, it's been a journey for us. So I have to say, we did start embedded completely within the businesses. And I have to say that was challenging. That didn't work. So we had to create a ring fence around it. The legal structure really helped us with solving the funding challenges, but the support from, CEO and XCOM level has been instrumental. The way we keep the connections going with the rest of the business is through, it's like a lot of the functional support comes from the rest of the business. Like there's a lot of volunteers that participate. We actually have a lot of our high potential talent rotate through. We've got a leadership program, so we have people go through that. So it becomes, there are connection points with the businesses. And even as we're doing this work in the regions that we're in, right? So we're doing a lot of work in India and Africa. We're very closely connected with our peers there. So in terms of sharing like best practices, it's like, how do you do good, so to speak? And it's also, part of it is we're unique in that sense. It is a healthcare company. We actually save lives, even in the rest of our business. So there are a lot of like good connections, and market development and physician training and patient access, all of that is already built in to the rest of the business. I think what we are able to do is take it a step deeper into truly underserved. And I think as we start to demonstrate that, like already we're having conversations with the other, what we call operating units, to say it's like, this is how you can expand and build on it. And, Jeff talks about democratizing healthcare. Like that's what we do in all of Medtronic. And this is just another piece of it. And the more examples of success we have, the more it gives permission for everyone to be bold and take risks. We share that broadly inside the company. So yeah, I think like it has actually worked quite nicely for us to have this separation, to give us space to innovate. And then because we're connected, we can share it back with the company.
Makes a lot of sense. I think that's a really, really interesting way of looking at it. Perhaps maybe one more question before we also move into the networking break that I'd love to hear from you, Ruchika. I mean, obviously you talked about, while you actually had a sort of positive ecosystem in the sense that your former and your current CEO are super supportive, et cetera, et cetera. At the same time, of course, also the last 10 years that you've just described have been pretty tough in making it work, in making sure these business models break even, in building those partnerships, et cetera. So in some ways, perhaps just talking about you as a person, what drives you and how are you keeping up the motivation after like 10 tough years Yeah, what's really your driver? What's your motivation? I'd love to hear about you as a person.
Well, so let's see. I'm, can't fit into anything. Apparently, that's my problem in life. But so I grew up in India, and so I mean, I've seen the challenges with healthcare firsthand, right? It's like when you grow up there. I mean, I sort of look at it as like the privilege of being able to come to the US, study here, work in a large medical device company. It's the intersection of the mission of the company as well. It's like, I have been at Medtronic for a very long time, so apologies for the Medtronic thing, but it's just like that's how it works after 20 years. But it's like we do talk about.
You're not that old, you're not that old, Ruchika, but fine.
Restore health, extend life. I learned that a long time ago. So we, so part of it is like we truly believe that. Like the founder of Medtronic was alive when I joined the company. I've heard him talk about this, I've met him multiple times. So you get inspired by that as a young person. It's like, yeah, we actually do these things, like we save people's lives. For me, coming from the place I come from, I look at like what is my responsibility in the world, right? Like with the privilege and the platform that I have, and a company and leadership that's dedicated to making a difference. If we don't do this, who's going to do this? Like, who in the world is going to solve healthcare problems? And I really look at like, nowhere in our personal or company mission does it say only for those who can afford it. It's like we have to solve these complex problems, and who better? It's like with the educational background I've had, the support and privilege and like the ability to see these problems and be exposed to that. Like I've been doing international business and emerging markets for 10 plus years. And it's like, I've been to all these places. I see the challenges, and you can't just walk away from that and say, oh, well, people can't afford this. Too bad, not my problem. So yeah, I feel like everything in my life added up to this. I think, at some point in the last few years, one of my mentors actually sent me a note. This is a Mark Twain saying, I think it's like the two most important days in your life, the day you're born and the day you find out why. And I don't know, I think a lot of my journey, like when I first started doing this, I'm like, the day I found out why, like this is my why and purpose in life. And I feel like I've been so fortunate that I've had that platform and support, and it's just like everything coming together. So yeah, that's kind of how I ended up here.
No, that's amazing, Ruchika. And I think like really what a nice sort of ending statement, sort of, if not me, then who? Or if not us, then who? And I think that probably may even hold true for other people here in the call. Probably everyone that is here on this call has had an awesome education and has had the privilege to have interesting roles. Perhaps not everyone, but many of us here in the call. So in some ways, I think it's such a great call to action. If not me, or if not us, then who? Which gives the responsibility back to all of us that are here. Ruchika, thank you so much. This was really, really amazing, just as a starting point, and we're not done yet. But as I mentioned, obviously, in all of the unusual talks, we always have a part where the unusual people in the room can meet. So for everyone in the room, don't be worried. If you're doing something else, it's fine. You can just, stay off camera if you're very uncomfortable. But if you do want to meet other unusual people, we will be throwing you into some breakout rooms now over the next 10 minutes, where you can meet each other, where you can mingle a little bit and think about what questions you want to ask to Ruchika. So basically the task, as soon as Paulina, who's kindly helping me here, throws you into those breakout rooms, what you can discuss with each other is A, what's your name? What's your background? And B, what's your interest in entrepreneurship? And C, what's the question that you would like to ask to Ruchika? I think everyone should be back, so please feel free to, now I see Ruchika again, so that's good news. Please feel free to throw your questions into the chat, the ones that you've been developing together with your colleagues. Is there a first question that's coming up already? Otherwise,
well, hello. Can I ask a question? Can you hear me?
You can. Normally I would just, ask it yourself this time. Normally I would say just put it in the chat because it's easier, but go ahead now that we're at it.
Sorry, I'm going to repeat. I did, it's in the chat. So if you want to take, if you want to take one of the chat questions.
No, go ahead, you start.
Okay. Well, hi, Ruchika, that was excellent, inspiring. Thank you so much. Mike, I'm Lauren Wyatt from Remy Health. We produce a connected otoscope. Tell you more about that sometime, I'm sure. Ruchika, so where next would Shuti, geographically, where else would you take it? I mean, there's a huge need in India, but do you have plans to take it to other geographies?
Yes, and I think we have some conversations going on with your team, Lauren.
Yes, you have. You have.
I have been hearing about that. Yes.
So it's lovely to meet you.
Yeah, nice to meet you too. So we actually have a project right now we're kicking off in Bhutan with the Ministry of Health there and the Gross National Happiness Commission. So that's immediately next. And I think beyond that, there's a handful of other countries. It's kind of we sort of look at the disease profile of the countries and the disease burden. And there's a few countries in Southeast Asia, I think Indonesia, Vietnam, Cambodia being some that are pretty high on the burden. And then I think working with the World Hearing Forum, there's a few other countries that they have been working with, Malawi, Pakistan. So we're trying to figure out partnerships again to go to these places. But yeah, definitely, I think our goal really, and this is one of the things about building a business, right? It's like the need is everywhere, but you can't go everywhere. You got to solidify and build something in one place. I think Omar is always telling me that, it's like, you got to focus and build something. It's like, don't get distracted. So we're trying to do that. And India is a big enough market sometimes. So I think we're finally feeling like we've got our feet underneath us and we've got something that's working. And now it's replicable enough to go to different countries. So yeah, just looking at disease profile for the countries and partnerships so that we can scale that. Yeah.
That's great. Thank you.
Thank you, Ruchika. I'm also getting some other interesting questions now jumping in. So basically, after looking back, after these 10 years that you've been in this sector, would you have taken that leap into becoming a social entrepreneur again? Or actually a social entrepreneur versus corporate social entrepreneur? Now, if I'm looking at the questions even more specific, why or why not? Like, what do you think is better? Is it better within a large corporation or outside on your own?
So I think I always had the dream to do something on my own. Now, after all these years, I think I prefer this, mainly for a few reasons. One is that there's tremendous power in large corporations. I feel like if you can't do it in a large corporation, I think doing it on your own is a heck of a lot harder because you've just got like so many people and experts. You can just pick up the phone and call. Like, I need a legal question help. There's like the best lawyers I can talk to. I want to talk to an ENT doctor. I can pick up the phone and call. Like, we've got doctors internally. So you just have tremendous access to resources and, just like senior leadership that can guide you. Like, I don't have to go looking for mentors. Like, I've got plenty of mentors inside Medtronic that can tell me, don't make these mistakes. So I think in some ways it's actually easier. Where I think people get lost is like the challenges of, not everybody's going to support you, but that's true whether you do it internally or externally. But you just have to think outside of your job description and look at those white spaces because there's tons of those white spaces and just be willing to fight the battles. But yeah, I feel like big corporations, like with the resources and footprint and capabilities and just like-minded, passionate people that you can find is kind of the best place to do it.
So intrapreneur is the way to go, I hear here, Ruchika. A clear proponent of the corporate social entrepreneurship model. That's great. And Philippe we're also getting a couple of more concrete questions here, by the way, for example, by Philippe Axus, who's asking about the price of the hearing devices and how many people could actually afford this? Like, how high is that price?
Yeah,
if you're willing to share that.
Yeah, for sure. So we actually, I mean, again, this goes back to really understanding the needs, right, of what a patient can afford for the segments that we're talking about. So the thing about underserved is, I sort of look at it as like, and I think this is on, I forget where I got this from, but there's about 5.5 billion people living between $2 to $32 per day. That's a very wide range. And this is, separate from the billion that live above $32 a day and can absolutely afford most of the stuff we're talking about. Now, when you think about that range, what does affordability mean, right? So you really look at it that way. For the patients that we look at, like we thought a lot about, okay, a month's take-home salary, 2 months take-home salary, like what are you willing to spend on like quality of life? And typically what was missing in this market, especially for India in like the urban poor segment, was in this like $100 to $150 price point where there weren't any good digital hearing aids, and translates roughly to about 7,000 to 10,000 rupees, which a lot of people are able to afford. Not everybody, but majority of the people are able to afford. And ironically, and this is like, you're talking about like sort of the informal economy. This is not people with jobs. This is like informal economy, sort of motorcycle drivers, home help, people like that. What we have found when we go in these communities and screen is that people actually want the higher end stuff. They're like, oh, do you have anything better than this? So we had to actually expand our portfolio for the slightly higher end because we were losing that market to other competitors because people wanted better products. So you start to realize like affordability is a very relative concept, and it's not a binary world of rich people and poor people can't afford anything. Very wide range, but truly trying to understand affordability and value and trying to match price points with that is kind of how we look at it.
Yeah. Fantastic. And I see one question that I think is actually a really great closing question, Ruchika, that I'd like to ask you, coming from Sarah Hillware, who's saying, basically, how did you create that internal buy-in? I think you touched on some of that earlier, but I think the main part of the question, which I'd love to ask you, is like, what advice do you have for other corporate social entrepreneurs that would want to start now with all of that experience that you have behind you?
Yeah, I would say be passionate. It's like first principles, right? Like if you're passionate about something, truly understand the need and the problem you're trying to solve. You're not going to have all the answers, but like getting everybody to buy into working with you to find the answers is the way to go. I mean, I've never, we say this a lot, is like, we'll figure it out. Like, I don't know, like, I don't, even when I present to our senior leadership, I usually am like, well, this is what we know right now. These are all the things we don't know. We're solving for this. And, I can't promise you this is how this is going to go, but this is the goal and the need that we're trying to solve. And I think you inspire people, right? Like, because all of us want to do good in the world, generally speaking. And I think if you can touch that and be sort of transparent and get people to help you, then that's the way to do it.
So in other words, what I'm hearing from you is be passionate and get help. I think those are the two main takeaways from a very successful corporate social entrepreneur, Ruchika Singhal. Ruchika, it was such an honor and pleasure to have you on our show, I would say, rather than call, because like, who wants another Zoom call? This is a show, okay? So thank you so much for making it today. I'm sure that I'm echoing the thank yous of everyone in the room. It was really inspiring. It was great to hear your concrete social business examples with Shuti and with Empower Health. And it was, and it was amazing to hear your personal story as well. So big thank you. And looking forward to getting to know you more as part of the Unusual Pioneers program over the next 6 to 9 months. So looking forward to that. Big thank you, and like a big virtual clap for Ruchika and her team, of course, at Medtronic. Thank you so much. And with that, I'd also like to close the day. Today was really lovely to have all of you here. Thanks for the interactions and also the breakout sessions. And I just want to put a little plug for our next upcoming event that we have. We have a very exciting one on the 16th of August, where we will be talking about how to transform the entire company into a force for good. The two main speakers will be obviously my co-founder and Peace Nobel laureate, Professor Mohammed Yunus, as well as the former CEO of Unilever and now chair of Imagine, Paul Polman, who obviously has been a leader in the whole sustainability movement and has also created a number of social entrepreneurship initiatives within Unilever over the years and is obviously seen as a main leader in this field. This will be sort of the kickoff of our Unusual Pioneers program on August 16th, as well as the Executive Circle, where there will be a private session after this event that everyone is invited to, together with the executives of all the large corporations. So I do urge you to spread the word, join us on the 16th of August between 2:30 and 3:30 Central European time. So please adjust to whatever your time is. And hope you can be there, and we'll have a really lively and exciting discussion. So looking forward to that. Thank you so much, everyone, again, and come back soon. Talk soon. Bye-bye.